Thank you, Katie. I guess we won't go through introductions again, then overwhelm you all with that, but we really appreciate the opportunity to share a little bit about our program and how we connect to other programs within our Bureau. I think just to add a little bit more context, Karen and I's program are within the Bureau of Family Health here at KDHE, kind of all things women, maternal, child health. We work really closely with those programs, as we'll talk about a bit later in our slides, but again, happy to be here. If there are questions that come up along the way, or if you need more clarity, please feel free to jump in. We're really an informal group and appreciate the back and forth. So if there's something that comes up that you're like, I've heard about this, but not quite sure. Can you explain that more? Please feel free to throw that in the chat, and we're happy to take a break and respond to it. So just a quick agenda here. Go through the learning objectives here on the next slide, the things that we just really hope you take away from this discussion or presentation today. A little bit about the Special Health Care Needs Program and dive into what those core services are for the program, how we connect with other Bureau of Family Health programs and external programs to support families and the special health care needs population, and then also a little bit about what we're focused on within the program now and as we look to move the program forward, and then close out with some Q&A and then a few of the key takeaways. So what we really hope you'll take from this presentation today is just understand a little bit about special health care needs. We've learned over the past year that while the program is great for those that we serve, there's so many across the state that just aren't familiar with the program itself. And so to have this opportunity to shine some light on the work that we do here and how we can support families is kind of an additional support to the work that's already taken place out in the community is we're really grateful about. A little bit about the role of the program within the Bureau of Family Health and how we see improved health outcomes for those individuals being served through the program. And then again, just to shine some light on the opportunities as you work with other families or partners in your respective work areas to kind of just, again, shine a light on the work that we do here and make those referrals and say, oh, I know about this program. If you work with this type of a family that has a child with special health care needs, have you connected with KDHE and their special health care needs program because they can be a great resource. So we like to start, this is our mission statement for our section. We really feel like all of the programs within our section fall within this mission statement, but really through a data-driven approach and relationship building, screening and surveillance strives to improve equitable access to information, services, and supports for newborns, mothers, and families. And we really use this as kind of our guiding light. We have a lot that goes on across our programs, but we always bring this back to center. What is our why for being here? And so we kind of use this to really lean into the work that we do. Karen, I'll let you kind of just quickly kind of introduce special health care needs here.
Thank you, Drew. Hi, everyone. The Special Health Care Needs Program provides services for children and youth up to the age of 21 who have eligible medical conditions. Every condition that is screened on the newborn screening panel is an automatic qualifier for our program, but there are others as well. Okay, and then our program has 4 main components for services that we offer, which is care coordination, direct assistance programs, or we call those DAPs, one-time diagnostics, and special bequest funding. And to explain a little more on the services, so we'll start with care coordination. Care coordination is something that is offered to all of our families. It is a free service, no matter what diagnosis the child has, as long as the family qualifies for our program, they are eligible to receive care coordination services. With the services, we look at all the needs in the household, not just the child that is in our program. We look at school, employment, medical needs, just all the needs, and how we try to come up with an action plan along with the family to help them navigate through the needs and the child's medical needs as well. This is an optional service for the family, just for the, we don't want to overwhelm some families. We know some of them already have a lot of case managers. So we give them the option to opt in or opt out at any time. And then we also have the RDAPS, Direct Assistance Programs, and this is special funding that we have for to fill in the gaps for our families whose maybe insurance might not be covering some medical services, some DME, some medication. So we have 9 DAPs to choose from, and we've been able to cover hearing aid molds, wheelchairs, orthodontic treatment for kiddos that have cleft lip, cleft palate. It's up to the family to decide what DAPs they want, but they are eligible for up to 2 DAPs each year.
And I think just a couple of other things on this. The care coordination is not income based. Again, if you have a child with special health care need or receiving Medicaid, you automatically qualify for those services. We currently have it built out into levels of support that are needed, from level 1 being kind of really just checking in with the family to make sure they have the supports, everything's going well, to level 3, which may be more intensive support, where our care coordinator team is meeting with that family weekly to kind of help them get them to the steps that they need to support their child, and navigate all the complexity that come with that. And then the DAPS, again, just a couple of examples that we have there, and we're continually looking at those to see where we can expand or bring on additional ones. But I think, yeah, that covers it. I was going to mention the special bequest, but I think that's on the next slide. So.
Okay, and then we also have one-time diagnostics, and this is a free service to any child residing in the state of Kansas. A family does not have to be in our program to take advantage of this service. We do not require proof of income, proof of insurance. All a family has to do is, if they suspect their child might need an evaluation for seizures or autism, they can just call our program and we will authorize that evaluation if they do not have insurance or their insurance is not willing to cover that diagnostic. The only thing is that we unfortunately cannot do genetic testing with the one-time diagnostic, but other than that, it's pretty much open to anybody in the state of Kansas. And then our last service that we have is special bequest, and this is a pretty cool part of our program. This is also some special funding that we have that that allows us to provide items that are not traditionally covered by an insurance to families, and they can range from anything from medical services to equipment to educational resources, conferences. As long as the child is in our program, they're able to request one item or service each quarter if there's a need. Some of the things that we've been able to cover with this have been home modifications, educational conferences, special swings, noise cancellation headphones, weighted blankets. So just anything that would not be considered a medical necessity per se by an insurance, but we know it's going to better the quality of life for the child, we can request under this service.
I guess that's a good place to kind of stop and ask questions about these services. We're curious, have people heard about special health care needs before, or have any experience working with special health care needs? Okay. Saw Rhonda shaking her head no, but
no. Drew, I have a question, or Karen. So what could you share just a few examples of what a one-time diagnostic would entail? Like what topic or what special health care need?
I guess the one for me that rings most prevalent is with our newborn screening program. So it is just a screening program. So it identifies an abnormality with the blood spot, and it's not considered diagnostic. So we may report out to the family, hey, you need to go and see a specialist here. The family, if their insurance wouldn't cover that diagnostic testing, could reach out to the special health care needs program and they would cover that. So it's, if a child, an abnormal screen for CF and they needed to go do sweat chloride testing and their insurance didn't cover that additional testing, they could reach out to special health care needs, they would approve that, and then the cost would be covered through the program.
Any other questions?
This is just, so we've, I guess to add some context, the Special Health Care Needs program has recently transitioned into our screening and surveillance section, which is where our newborn screening programs live, and our birth defect surveillance program. And so with that, we've kind of just taken on this total review and assessment of all of our program activities and our resources. And so we just recently developed this brochure, and so we kind of wanted to promote it a bit. So if you work with families who may have a child with a special health care need, or you know of a location where this would be a useful resource for them, we just kind of wanted to promote this here. Feel free to reach out to Karen or myself, and we're happy to get these out in print, in the mail, or whatever it may be. But again, explains a little bit about the program, some of the partnerships we work with. We do contract with the Medically Complex Clinic that does a number of things for special health care needs families, but host clinics in their facility, but also host some frontier clinics to meet the needs of those individuals that live in rural Kansas. The CPRF Foundation that does seating for meeting wheelchair needs for the special health care needs population, and then cleft lip, cleft palate, as Karen mentioned as well. And then in line with developing the new resource, we've also just recently developed a new website for our section and are working to build in the special health care needs program to that. But kind of wanted to share, this is something that was driven from feedback that we gotten from providers and families about navigating our agency website and really being challenging to get to critical information in a timely manner, and which is especially important for our newborn screening conditions, where some of them may be time critical and life-threatening. And so if we refer a provider to our website, they were having trouble, multiple clicks. And so we built this website. We're really proud of the end product, and hope that we can do more to share some of the stories of families that are affected or impacted by our program's work, and hope that this is a much more user-friendly experience for them as well. This is another resource that kind of ties together, and was a project started within our newborn screening program, kind of pulled in a number of individuals, but it's, like it says here, a compilation of 20 different programs and organizations that kind of span the lifeline in the prenatal period through 18 years of age, but highlights where the programs and services may be useful to families. This is, again, a resource that's free. We're happy to provide if you know of a location where it would be useful to families. We're trying to think outside of the box. We've gotten it in libraries, a couple of small grocery stores that were open to putting the resource up in their infants, the formula section of the store. But I have 2 children. When I started working here 5 years ago, these were things that I had no clue about. And so we really feel like the biggest hurdle that we have to a lot of our work is just making it accessible to those who need it most. And so this is kind of the product of that. Again, if you reach out to Karen or I, and you're like, oh, we love the resource, or if you read through the resource and you say, hey, there's something missing that me as a parent of a child with special health care need, or a provider, that would be great in here. We're always taking feedback and updating new iterations as well. It is available in these additional 7 languages too, because we know that we have a really diverse population across Kansas. But if there are individuals that you work with that have languages that aren't supported with these resources, we do have language interpreting services available through our agency, and we're happy to connect individuals with those two to better support those families as well. And then I mentioned we'll talk a little bit about our current and future focus. I think with Karen being new as a program manager, having been in the program for quite some time, but moving into a leadership role, and then the program moving with our other section programs, we've really focused on quality as being kind of the core thing, getting back to the basics and ensuring what the program is intended to do is what it is doing, and scaling back from some of the other initiatives that really had us spread a little bit thin, and focusing really on the family first perspective and supporting our staff who deliver those critical services to families. And so with that, like I said, assessing our program materials, our strategy around community engagement and what events that we've been attending and or not attending, and how we can really kind of improve in that area, but also getting the family input. And so Karen and I will be working with our long-term follow-up program manager that we recently hired on, to be surveying some of our special health care needs families to really help inform some of our strategy, our training, our staff development, to know that we're truly meeting the needs of these families when it's appropriate, and then making the necessary adjustments. We're also looking, Karen mentioned the DAPs. Those are something that been pretty uniform for the past several years. We have added other direct assistance programs as we've identified, but we want to really look at who are accessing those DAPs, what populations are we serving. If we have a DAP that's been underutilized for the last 2 years, how do we engage that community and that population to create some awareness around it so that, there was intent for creating that DAP. Let's get those populations connected to them to make sure that we're serving them better. One such example is we've recently done some presentations and connected with our CF Foundation to better connect those families that are working through the center with our special health care needs program. So we really see ourselves as a gap filling service. We know that, like Karen mentioned, a lot of families have case managers in one setting or the other. And so it's not to supplant that, but really just to supplement and to provide additional support where we can. And here is just kind of, again, to bring some awareness. We know when I started, I had no idea about all the programs that took place within the Bureau of Family Health. And we so often talk about breaking down silos. And I think a lot of the work that we've done within the agency and the Bureau itself has just been to break down those silos internally, and align some of our activities and work to ensure that if one has a goal in mind and the other has a similar goal, that we're not just driving down the road in separate lanes. It's really getting together and making sure that we're moving in one direction. And so you can see here some of the programs we work with for special health care needs. Newborn screening, really important. We learned through some analysis that our sickle cell disease population not being served through our special health care needs program, and it's one of the highest identified conditions through newborn screening. And so that's an area that we want to do better in. And over the last 3 months, have connected with the Sickle Cell Association, and we'll be engaging in a project with them to roll out some education and awareness activities over the next year. So we're excited about that. We also work really closely with Part C, formerly known as Part C. It's gone through some name changes, currently known as Kansas Early Childhood Development Services. You may be familiar with that. I think we have a slide that'll maybe dig into a little bit more about what that is. But again, for us, it's just to make sure that families are aware of these programs and services that really do help with health outcomes and the developmental milestones for their children. We work really closely with WIC, which can be surprising to some, as along with child care licensing, they are all housed within the Bureau of Family Health, and we share the same goal. It's our populations are the same, serving women, children, the birthing population. And so we're really working to leverage the relationships that WIC have with their families. We know that through some analysis that we've done, a lot of on our newborn screening side, those children that are lost to follow-up, which is a key metric, are typically those that are under-resourced, lower income. And so for us, connecting with WIC was a natural relationship. If they're already working with a family, that's another opportunity and touch point for that family to get critical information that they may not have otherwise. And so really kind of lean into these other programs to support ours, but also then to, in the reverse, support theirs as well. And then the clinics that we have a great relationship with, they do amazing things for children and families. We're fortunate enough to get to visit the MCC clinic this last summer, along with CPRF, to see kind of what takes place on the ground. And then we attended an adaptive golf clinic where MCC partnered with the Corn Ferry Tour to bring some families in and take them to Topgolf and let kids do some things that they wouldn't have been able to do otherwise. And so really appreciative of these collaborations, but it is how our work continues to move forward. And so we really feel like we're only as strong as the partnerships we have, and are always looking to expand and improve in those areas as well. Mention Part C, or there's no great acronym for this, KECDS, but they do serve families 0 to 3. I think Part C is probably a little bit more familiar to those on the call, but if you ever have any questions or need additional information related to Part C or that programming, please feel free to reach out to Karen and I. They're also housed within the Bureau of Family Health. We have a great relationship with their program manager and team. Our hearing coordinator often goes out and does trainings on hearing equipment and doing screens for the Part C program. So really a great collaboration there too. And then one of the things we kind of want to mention, it's not necessarily connected directly to the special health care needs program, but this is an initiative for our hearing program. It's a late onset hearing loss awareness campaign, and just something to kind of put out there in the ethersphere, that our hearing coordinator, who is an audiologist by trade, really passionate about, something that I learned a lot about, but just to put that out there as a question to be asked of parents and families. If you see some of these things in children, ask when's the last time that they had their hearing tested, because finding a lot of times, a child may have hearing at a certain milestone, but then things can occur between, if it's sickness or some other event that may cause hearing loss between the next hearing test. And so we've seen a gap between the newborn screen and then maybe when a child is tested before they start school. And so if there's questions around any of these things, ask when their last hearing screen was. Feel free to reach out again to Karen or myself, and we'll connect you with our hearing program. But this is something that they're learning through a lot of research, may be impacting children and undiagnosed hearing loss that's causing kind of downstream impacts related to developmental delays, social emotional problems, etc. So that was a really quick, fast overview, but just again, some key takeaways that we have from that: support children up to the age of 21. There is a little bit of nuance there, but a lot of it is very specific to the funding that we receive for the program, which comes from our maternal child health block grant, Title V funding. And so there are some nuances around if a child is approved for some supportive devices before they turn 21 and those types of things. But if you ever have questions, we're really working on focusing on that transitional period too, to ensure that families have the support they need once a child moves on from the special health care needs program. Any child receiving Medicaid would qualify for program services. I don't know if we mentioned it, but special bequest, you do need to be a part of the special health care needs program to be eligible for the special bequest funding. But again, income eligibility, even if you are over our income guidelines, which is a sliding fee scale. So if a family is over certain income guidelines, we may cover a percentage of a DME or a certain service. That is not applied to the special bequest. So it's not a sliding fee scale. The special bequest is special funding that's separate from our Title V funding. So it operates under its own rules and regulations, so to speak. So if a family has a request, there's not, okay, you need to cover this percentage, there are some cap guidelines on the amount that per request for special bequests, but nothing similar to our special health care needs program where income for family is equated into that as well. Families can select 2 direct assistance programs. I'll put the caveat that those are things that we're looking at. Should it be limited to direct assistance programs, or should it be more of a cap per family? Because we know that some of the direct assistance programs, the need may be much lower, where DME, durable medical equipment, that one piece of equipment may be much more expensive. And so we're looking at some of those things as we evaluate the program too. Quality of service, again, of kind of a key importance to us. We know that if we're not doing for families and meeting them where they need, then it's kind of counterproductive to the point of our program. And for us at a leadership standpoint, that means supporting our care coordinators so that they feel supported to support families. And so we really love any and all feedback. If you've had an experience, good, bad, or otherwise, we love to hear that so that we can adapt. We know that we're not perfect. With the state and working with some of the state programs, we know that there can sometimes be a perception about the state and their intention too. So we're always happy to take that feedback and learn how we can do better. But just want to put that out there. We really also depend on referrals and word of mouth. We do as best we can, but funding is limited. Our staffing capacity is limited. And so sometimes we can forget to get out there and have boots on the ground and inform about some of these things. I think as we've done presentations and talked about special bequest, even, it's something that no one really knows about. And so it's something that we want to be more proactive in promoting so that those who are maybe falling through the cracks have an opportunity to access some of these things that they may not have known about otherwise. And then the last couple things here is just how closely we work with other Bureau of Family Health programs, other maternal child health programs, and that we truly do take that. I know sometimes they can say there's a no wrong door approach. I promise you, if you reach out to me and it's completely unrelated, if it has anything to do with anything within our building, Medicaid, environment side, the lead program, vital statistics, I am happy to run down a connection or resource that I know and see if I can do a warm handoff there. So that's really the thing we want to leave you with. Karen, I ran through those. Is there anything that you'd like to add to that?
No, I think you pretty much covered it all.
And then I think the last slide here is just our contact information. And so please make note of it. Feel free to reach out if you have questions following, or, as you're going to sleep at night, something triggers, feel free to email myself or Karen or call. I don't get very many office calls, so it would be nice to have my phone ring. And I think with that, we're open to any questions, and maybe we answered everything, but happy to field any.
And feel free to as well, like if you have a question, you can come off mute, or if you want to type it, I'll read it too. I have no problem doing that.
Drew, I had a question.
Yeah.
So I saw on the slides, and I also heard you all say that it's not driven by income. So I did see in another slide, though, that it said that your program would cover anything that's left over after your insurance processes it, if it's covered. Is that correct? So if I have Blue Cross Blue Shield and let's say I need a wheelchair for my child and they cover up to $250, then I could reach out and you all then would pay the difference?
Yeah, I think that might fall under the specific DAP, but I think that is the goal. If there's a copay, copay support is also one of those DAPs. Yeah, it's really there to just fill any gaps for that funding. It does need to be the payer of last resort. So we do have to kind of go through, for us, we've kind of documented, we have historical kind of record of, okay, we know that this would be approved through Medicaid or it won't be. We don't need to wait for official rejection letter because we know that getting this to the family timely is important. So we'll go ahead and approve some of those things. Some things we have to wait for an official Medicaid rejection letter or insurance letter that says we're not going to cover this before we do. But it can vary a little bit depending on provider and things. But yeah, that's absolutely just intended to support the family. Says, yeah, we don't have this additional coverage, but we need this device or we need this. The program's there to do that.
Thank you. Could you, and I might have missed this, but could you kind of walk through if you were a parent or how you would walk through contacting you all? Is there a website, and then what's kind of the process?
There's a website that we're working on, I think, getting a electronic application up and going. That's been quite the process. For us, if you're identified, so for our newborn screening program, when we receive a diagnosis that's been confirmed, for us, our next step is then to refer them to special healthcare needs and also send information to the family. I'll let Karen speak a little bit about those that aren't identified through newborn screening, but typically, again, it's through some of the providers that we work with. They have a family that has a child with special healthcare needs. Here's an application. Here's kind of the next steps that are included in that. But once the program receives it, Karen, I'll let you speak to what kind of happens on our side or how that what that follow-up looks like.
So once the application is received, and we also have a lot of families that just call and ask about the program, so we're more than willing to mail out an application. Hopefully we'll get our online application system going soon, but for now we just have the paper application. But once they're in our program, the application can take up to 2 weeks to be processed if we have all the proper documentation. And then the family will get a call from the care coordinator who will then just ask questions and try to identify any needs in the household that they might be needing assistance with. And then we'll go over all the services and try to work with the family to see what they best could benefit from, which tab, and then just start authorizing services as needed for the family.
And are you seeing any applications of services or supports needed for children with autism?
I'll jump in, Karen. You can fill me in. Autism isn't a qualifying condition on its own, although we feel very differently about that, but because of the way the funding works. But if a child has autism in addition to a co-diagnosis, that is qualified. But yeah, Karen, do you want to add to that? I think from a care coordination standpoint, we're always open to serving children and families. But when it comes to kind of the funding aspect of it, it's a little bit grayer line, although we are totally fine with pushing the boundaries, or at least I am, and asking for forgiveness after the fact. But Karen, do you want to add to that?
So there is a little loophole if the child's only diagnosis is autism, but they're receiving SSI income, we are able to get them on the program and offer the care coordination services as well as the special bequest. Unfortunately, we can't help with DAPS, but through special bequest, that is funding. So we're able to help with communication devices, or we had a kiddo who that was his only diagnosis, and dad called and he said he kept wandering off, so we paid for their backyard to be fenced. So we can do things like that through special bequest if the child is receiving SSI.
Okay, excellent. That's great to know. Thank you.